This is the KDKA Morning Show.
And that we've all been waiting for, too, the results of the QuickLift procedure. This is the before of our KDKA QuickLift contest winner. Up next, see how she looks now, 1 week after the QuickLift. See if you think the procedure took years off her face when the KDKA Morning Show continues right after this. Welcome back to the KDKA Morning Show. We are excited this morning to show you the results of the QuickLift procedure. Last Monday, remember, we introduced you to Paula McCelland of Pleasant Hill. She won the QuickLift procedure from Dr. Dominic Brandy of the Skin Center in a contest right here on KDKA TV. She says she wanted to get rid of what she calls a gobbler hanging under her chin. After she and Dr. Brandy appeared on our show Monday, we followed them right over to the Skin Center, and a camera was there to capture the procedure for you. And wait till you see her. Dr. Brandy and Paula are here with us now to show us the results of her QuickLift. I hope we can zoom right in on you. I can't believe you look fantastic.
Thank you.
I told you looked fantastic before. Do you have tears in your eyes?
Real. Gobble no more.
Yeah. I told you. I really thought that you looked fantastic before, but what a difference.
You're a little shocked, huh?
It's
beautiful. He does amazing work. I'm amazed. I'm amazed that pain-free, little discomfort.
Quick?
You know. Oh, an hour. An hour. Went back to work. Worked the rest of the week.
I think it was an hour and 15 minutes.
The fanatic.
And you said that she was calm. She said last Monday that she was a little apprehensive about being knocked out or being awake or what.
Well, what we do, we kind of give a little dose of Valium and a little bit of Darvocet, so that just takes the edge off. So it puts you in a kind of a happy mood. You just, like I said, we chit chat, and she likes to talk. I like to talk, so.
It was good. This is where you were consulting with her before.
Right. This was right before the procedure. We were just kind of, I was trying to give her an idea of what was going to happen to her. That was going into the the procedure room.
And there you go.
Right beforehand.
Now you have the lines drawn on the face.
Right.
You
and that one, that just shows where we're going to go, under the skin and so forth. She's all ready.
She's smiling though.
Yeah. You can see she's awake. She's not under any kind of general anesthesia or anything.
Yeah.
Just kind of prep things.
So you monitor everything and you start the surgery.
And then just showing me, doing the procedure. You can see she's up, and we doing the procedure in there.
Yeah. But it didn't feel like you were in there for very long at all? You were calm the whole time?
I walked out and met my husband.
You mentioned your husband, and he's with you today, and I think we have some tape, actually. We can stop and listen for a minute to his reaction. What do you think?
This was right after.
Gobbler gone, baby. Is that unreal?
You look marvelous.
You can see the gobbler's gone there. You can see right there swelling, and that's normal right after.
Hey, not bad, though. I mean, that was right after you walked out.
That's immediately after the surgery.
Wow. Wow, wow. So you have the picture. Let's show that. That's very dramatic.
If you look closely, you can see that.
There we go. Go ahead. I can hold it if you want to.
As you can see, if you look, mainly what it does, it really accentuates the jawline. You can see how nice and smooth that is compared to before. And she had quite a bit of skin. There was about a little bit more than an inch on each side, so there's a couple inches of skin that we removed when we did that.
You're happy he's pointing that out, aren't you? You enjoy this picture.
I could have coffee. That's all right.
This is pretty typical, what you'll see with patients.
Wow.
But the nice thing is, I don't know if you go to work at all.
Yes, I went right there. I watched children in my home, so they were there waiting for me, and the rest of the week watched them.
No pain? Not very much, you said?
I took 2 pain pills, and that was only because I had to sleep on my back, and I'm not used to that. I'm a fetal position sleeper, and I did not need them. So absolutely no pain medication that I take, even though they told me take your pain medication. That was not my thing. I did not need it, so I thought, why take it?
Doctor, go over again for us. Who is the best candidate for something like this?
Well, I would say most of the patients that we do are between 40 and 60. I would say the majority. But the advantage of the QuickLift is that because it's primarily an upward elevation of the skin, We've done patients in their 70s.
Okay.
So, but I would say most of the patients we're doing are between 40 and 60, 65, kind of around there. So I would say that's probably the prime age. But even patients that are older, I think, can get an excellent result, primarily because there's an upward vector. And that's why you see the improvement in the neck. Because if you advance upward, you can see how the skin just kind of comes this way. So that really avoids the necessity to get into this area in really lifting the skin under the neck.
Yeah.
Which makes the recuperation much, much more pleasant.
Yeah.
And allows you to do it under local anesthesia.
Even before QuickLift was this gobbler thing that people have the most common thing that people would come in for.
I would say most people are concerned about the jaw in the neck area, and that's what this procedure addresses.
Takes care of all of that, though.
Right.
It's probably changed your practice a great deal.
Oh yeah, it definitely has. In fact, I had a little tendonitis this morning from doing so many surgeries. Yeah, but it has. I mean, it's become very, very popular because people just don't want the downtime. A lot of people are afraid of the anesthesia. They're afraid of going under general anesthetic. So with this, you can do under local. It's done very quickly. A lot of people can get back to work anywhere from a day to a week typically, and it really fits into people's lifestyle.
What did your friends say when they saw
I
you?
think it's great. First of all, I can't believe that I even did it because
you were president of the club.
I'm president. No more.
No more. You have to vote somebody else into office.
Right.
The Gobbler Club is what we're talking about.
Right.
But they all said, you got to be kidding me. They said literally if they did not know me and I was on the street, you would never know that I had it because I had a little bit of swelling, which my close friends obviously know my face. But they said it's amazing. I said it's amazing, and the staff, unbelievable, professional from the time you walk in. Everybody was treated the absolute same, and no matter what procedure it was, it's
wonderful.
I'm thrilled.
Gobbler's great. She is smooth. And you give consultations. How do you want people to approach this if they are interested?
Well, they could call our office. We have an 800 number, 1-800-429-1151. So we set up consultations, and then normally we spend about half an hour with the patient, just kind of going over the pros and cons and seeing if they're good candidates.
You work out of the Skin Center, and give us that 800 number again.
Okay, it's 1-800-429-1151.
Okay, we had so much interest just in the contest itself, so I know that a lot of people will be watching today to see how you look.
Thanksgiving.
This year, huh? I said a lot of lower cut shirts this summer. Thank you so much. Congratulations.
Thank you.
Great work. Thanks for coming in.
Okay.